So good afternoon, everyone. It's really, really lovely to be here today. So they have mentioned a couple of my roles, but I actually have more roles, so I should just tell you about that as well. So I'm also an honorary consultant in public health at South Gloucestershire Local Authority, and I've met a few people who are doing public health already at lunch. And I'm also coming to the end of my NIHR Advanced Fellowship, and it was called a postdoctoral award when I applied for it. So, I mean, this is Karen's second time lucky because so a couple of months ago, an email arrived in my inbox from Karen and my heart sank. And my heart sank because I knew what it was going to be about. And it was because I had received an email last year inviting me to give the inspirational speaker talk at an event very similar, the same event basically last year. Now, I had a good excuse because my husband was going to be traveling abroad for a conference. He's an academic as well in physics. And I have a 3-year-old little person, a human, that I need to look after, although he's often more feral than human. But anyways, I had a good excuse last year. I couldn't do it. But this year, I had no such excuse. So here I am to give the inspirational talk. Now, what I'm going to do is I'm going to kind of share a bit of my career journey, so talk about some of the successes as well as the challenges I've faced along the way. And I'll also like to end by giving you a little bit of advice that you can use in your own career journey. And you'll tell me at the end whether or not I've actually met the brief. So, I've taken this picture and this quote from one of my favorite movies, Sound of Music. And it's from something that Maria said. And I'm going to start at the very beginning because it often is a very good place to start. And I'm going to share some disparate photos, but they're all linked and they have something in common. And I expect you didn't think that you were going to see a picture of Nicki Minaj when you left home this morning. But anyways, there she is. And I want you to tell me what links all of these different photos, because whatever they share in common, I also have in common with these photos. So does anyone want to hazard a guess what links all these different photos together? And Steve is not allowed to answer. Anyone wants to guess? Caribbean. Anything more specific? Trinidad. Yes, exactly. I heard somebody say Barbados. I shall ignore that. But it is Trinidad. And the top photo, so on the top photo on your left is a picture of Port of Spain, Trinidad. That's the capital of Trinidad and Tobago. And you can see our twin towers there. Then we have Nicki Minaj, who's an American rapper of Trinidadian heritage. Most of you probably wouldn't have come into contact with her, except for her very infamous statement last year about her cousin in Trinidad who'd taken the COVID vaccine and unfortunately came about with swollen testicles. Now, our Minister of Health then said that this absolutely made no sense, and we almost revoked her citizenship for that nonsense. But anyways, all is fine with this cousin in Trinidad who remains unnamed, but that is also the link with Nicki Minaj. At the bottom, we have V.S. Naipaul, and he was the Nobel Laureate in Literature in 2001. He passed away a couple of years ago, but very, very well known for a lot of his books. Then we have Brian Lara, who was considered to be one of the best batsmen of all time when he was active for the West Indies. And then the final picture, which is what Steve's just sharing a story about where the NIHR was conceived. This is Pigeon Point Beach in Tobago. It's one of my favorite places in the world, a really, really lovely beach to go to. So I am Trinidadian. These are pictures of Trinidad as well as Trinidad and Tobago. So what am I doing here? And it all starts with this guy who's been dead for more than 120 years. And some of you might recognize him because he's quite a controversial figure, and this is Cecil Rhodes. And I am here because I am a Commonwealth Caribbean Rhodes Scholar, and I got that scholarship in 2003. So I made that journey all the way from Trinidad up to England, and I arrived at Trinity College, Oxford. And there were 3 reasons why I chose Trinity College, Oxford. One was the name, Trinity. It's named after the Trinity, and I'm from Trinidad, so it's like, ooh, there's a link there, so we'll have that. The second was that it was one of the few Oxford colleges that would actually provide accommodation, so student accommodation, for the entire duration of your course if you're an international student. So that was quite important to me. And the third was my tummy. My tummy is very important to me. and I was told that British food is very bland and very tasteless, and that food at Trinity was actually edible. So that, I would say, was the most important reason why I chose Trinity College, because I couldn't cook at the time and I needed to be able to eat or else I would starve to death. So I ended up at Trinity College, Oxford. But why did I leave Trinidad? Because I had a very, very lovely life there. You know, I had just finished medical school, I had graduated with distinction, I could choose any training program, I had my friends, I had my family, we had good weather, everything was perfect. So there wasn't really that kind of push factor for me to leave Trinidad. But there was a very important pull factor. And that pull factor was that I wanted to do, you know, postgraduate training in public health and epidemiology. And this was because I was already frustrated with clinical medicine. I hadn't even started practicing. You know, I hadn't even done my internship. And I was already frustrated with the practice of medicine. And this frustration started during my elective. So as a fourth-year medical student, when I was doing an OBGYN placement, and I was asked to kind of investigate, look at the rates of cervical cancer incidence and mortality in Trinidad and kind of compare them with other countries. And we had shockingly high cervical cancer incidence and cervical cancer mortality rates. But what shocked me even more is that these differences in rates weren't really due to lack of treatment or differences in treatment. They actually came down to screening programs. So places like the UK had these national call and recall screening programs where women were called in and they were screened. Whereas in Trinidad, it was all ad hoc. It was left up to women whether or not they were going to turn up for screening. Now, of course, if you know anything about cervical cancer screening, you're actually detecting the pre-invasive stages of cancer. So you detect it early, you could intervene before women even get to developing cancer. And that made all the difference. I was already noticing from kind of my medical placements as a student that we had a lot of diabetes, a lot of heart disease, so strokes, a lot of vascular disease, strokes, heart attacks, you know, and cancers as well. And a lot of these were really associated with lifestyle factors, so poor lifestyle factors, so, you know, not eating well, so unhealthy diets, drinking too much, smoking, lack of physical activity, obesity. These were all the major culprits that were contributing to disease. Yet we were spending all of our time dealing with the results of these lifestyle factors and not enough time preventing these illnesses from happening in the first place. So that was my major pull. I wanted to come up and I wanted to do postgraduate research. So I came up and I was all, you know, all singing, all dancing on this fantastic scholarship, and everything came crashing down. I absolutely hated it. Absolutely hated it. And what I know now, but what I didn't know at the time, is that I was experiencing culture shock. And I've kind of listed what culture shock is there. So it's the impact of moving from a familiar culture to one which is unfamiliar. And it's an experience described by people who have traveled abroad to work, live, or study. And it can be even felt to a certain extent when you go on holiday. And it can affect anyone, including international students. And it certainly affected me. And I'm talking about it because you don't have to move countries to experience culture shock. You could kind of, you know, move organizations, move from one university to another, move home, so move from one part of England to another part of England. And sometimes that difference in culture can really, really throw you. It can really, really have a negative impact on you. I experienced a lot of these symptoms of culture shock. I was incredibly homesick. I remember I used to cry every day in my room. I was so homesick. You know, I was very, very lonely as well, you know, but eventually over time, I was able to kind of form a group, make lots of friends, have a great time, and, you know, basically adapt and assimilate into the culture. And now, 20 years on, I consider myself as British as I consider myself Trinidadian. So, but it's just something to be aware of, and this is one of the biggest challenges I've faced in my career journey. So I'll talk a little bit about me and my career timeline because it's a little bit different from what you might expect because I'm not 100% full academic doing 100% full academic activities. You know, I like to do different things. I like variety. If you talk to my husband, he'll tell you I have multiples of handbags and shoes. I only have the one husband and the one child, but I have multiples and everything else. So that's just who I am. So as I said, back in 2003, I finished my medical training. I came up here, completed these 2 master's degrees in Oxford, and started my foundation training in the Oxford Deanery. I then got married in 2007. My husband says I married him for his visa. Friends, I did not marry him for his visa. I married him because I needed a cook and I needed a driver. And he continues to do those jobs most admirably 16 years into our marriage. I then started my academic clinical fellowship in public health specialty training at the University of Bristol, and it was Bristol Primary Care Trust at the time. That's now been abolished. And then I started my NIHR Doctoral Fellowship at University of Bristol. So I'm a bit of an NIHR kind of person. I like getting funding from the NIHR, and they seem to like giving me funding most of the times. I finished my PhD in 2013, had my Viva in 2014, and then started another NIHR kind of program. So it was the academic clinical lectureship, and I did this at University of Bristol, and it was a South Gloss local authority because public health had moved from the NHS into local authorities by this point in time. I got a small starter grant for clinical lecturers, so it's something you should be aware of. The Academy of Medical Sciences often offers these small grants. It was only £30,000 at the time, but it allowed me to be able to access a database that was quite expensive to use, the Clinical Practice Research Data Link. I also applied for 2 NIHR HTA grants. These were slightly different HTA calls. There was an evidence synthesis call where I led a network meta-analysis for the effectiveness and safety of smoking cessation medicines and e-cigarettes. And also there was an efficient study designs call. So at the time, they were really interested in people using these large databases to do observational research. So I did that as well. Then I completed my specialty training, started my first consultant post in 2016. Then I went for another, it was the NIHR postdoctoral fellowship at the time, which has now been renamed the Advanced Fellowship. Started as a consultant senior lecturer at University of Bristol, and that's when I started in the clinical director role at the NIHR CRN. Had my son back in 2020 in the middle of a pandemic. I didn't know a pandemic was coming, but it came. But during that time when everything went on hold, I took the opportunity to apply for a small local authority systems grant. So that was only £50,000, and it was about understanding what local authorities needed to establish research infrastructure. Came back to work in 2021, then got promoted last year. And then also I've gone for a protector grant with some NHS colleagues. So that's been a bit about a whistle-stop tour of my career timeline over the last 20 years. So I won't tell you how old I am, but anyways, I'm getting older every day. So my first role profile is the one that will be most familiar to you as academics and people who are developing an academic career, and that's my associate professorship in public health medicine. So they've mentioned my research. It's opioid analgesic dependence and nicotine dependence. Of course, a lot of it is about obtaining research funding as well, but I also do a lot of teaching. So I teach medical students at undergraduate level and postgraduate students on the MSc Public Health. This profile, so this role as clinical director of the NIHR is a little bit different because that's a senior clinical management role. So in this role, I lead a team of 60. We have £17 million of funding a year. And it's all about systems working and working in partnerships, which I really enjoy as a public health consultant. We are responsible for delivering the NIHR portfolio studies, so some of you in the audience might have some of your work supported by the CRN in your region. And we also support kind of some workforce and training and working together with patients and public. So there's a lot of community engagement as part of what we do as well. And the final role is as a consultant in public health at South Gloss Council, and there I'm the lead for clinical governance, research governance, and building an academic function. And it's important for you to understand that local authorities, unlike the NHS, are not really places that are accustomed to using evidence. It's not really evidence-based organizations. If any of you have ever interacted with, local elected members, often they go on their own stories of people in the community. They don't really use evidence in the same way. But I'm quite passionate about supporting local authorities to be evidence-based, to become places that are research active, and to actually use some of this evidence in decision-making. So that's something I'm quite passionate about as well. So that was a little bit about me and my career and what I've done. And now I'm going to go to the advice bit, but I expect you to take this with a pinch of salt. So I'm sharing these two quotes. And one is by Ricky Gervais. The best advice I've ever received is no one else knows what they're doing either. So keep that in mind. And the second quote is, I'll give you the same advice I give my children, never take advice from anybody. So that's what I'm saying. Take everything I say with a pinch of salt, okay? And my first tip is that you have to do what you love. You might have a career that might span 20, 30, 40 years. And if you aren't passionate about what you're doing, you're not going to be able to kind of carry on in the long haul. You have to do what you love. You have to love what you do. Also, life, unfortunately, is not necessarily rabbits and rainbows. We might like it to be, but it isn't. You might face personal setbacks, so this might be bereavement, chronic illness, relationship breakdown. For 7 years of my life, before I had the feral human, I was trying and failing to start a family, so that was a long journey that I had to go on myself. It was quite a hard journey to be on. So there might be loads of different things that you might be facing as well. So the thing that's going to keep you going is if you're doing something that you're really, really passionate about. So do what you love and love what you do. The second tip is to embrace opportunities, because sometimes opportunities might just present themselves to you. I mean, I've certainly had that happen. It's like, oh, really? Thank you, world. That's great. But often, opportunities don't just present themselves to you. So you need to be able to think outside the box. I know that might sound a little bit trite, but you really do need to think outside the box or create your own box or whatever it is they say. But you need to embrace opportunities that appear wherever they might be. And you need to knock down doors and kind of see who answers. And I am going to use the example of my role as the clinical director for the Sierra and West of England. That was an opportunity that presented itself to me. A director of public health in a neighboring local authority sent me the job advert and says, this seems like this would suit you. When I spoke to people, they were like, oh, no, you've just become a consultant. You don't have enough gravitas to do that role, because I wasn't suitably gray-haired enough and I didn't have a fetching beard either. So I didn't meet the gravitas criteria. But also, they hadn't really given it to somebody with a public health background. It usually went to somebody who was a hospital consultant or maybe even a GP. So I was quite unusual in terms of wanting to do it at my stage of career, so new consultant, and the kind of background I had as a public health person. But anyways, I went forward because, I like to do things that people don't expect me to be able to do. And I was able to get the position and secure the position. It was a very exciting time for the CRN then. They were all about expanding into public health and social care, thinking about how we should target research to health need, so to make sure that the areas that were carrying out research were the areas with highest disease prevalence, which really spoke to me with a public health background. I've now been doing the role for 6 years, and it has also provided so many more opportunities because it's increased my profile regionally and nationally. So I would say embrace opportunities, think outside the box. The third tip is to dare to be different. So winners don't do different things, they do things differently. And if you always do what you always did, you will always get what you always got. Bit of a tongue twister, but you know what I mean. And I'm saying this because the NHS, we are facing huge challenges now. They're really, really complex problems. And the solutions to these are going to require us to think differently about what kind of research we need to do, who are we going to need to work with. You're going to have to do things differently. So I think be brave, be courageous, and dare to be different. So an example I'll give from my own career at the moment, I'm working with NHS colleagues, so a vascular surgeon anaesthetist, which is very outside my box as a public health consultant, but they're interested in developing a perioperative smoking cessation operation because, of course, all the patients they're seeing who are needing these operations and vascular surgery are smokers. That's such a public health thing. There's such an opportunity to intervene at that stage, and there's still good evidence that if you stop smoking then, you have less wound complications as a result of surgery and you have faster recovery. So, I'm daring to be different. I'm trying to do things differently. The fourth tip is to collaborate, 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 because collaboration is multiplication. And talk to everyone, talk to other academics in other institutions as well, talk to industry, talk to patients, really, I'm talking, as I said, to elected members in local authorities, people who are decision makers. Really be generous in terms of kind of ideas and what you're wanting to do, because you're not going to be able to deliver everything yourself. You're going to need a group of people. You're going to need different skills, different expertise, people who think differently to you to make everything all richer. And I think sometimes even sharing ideas, people can come back to you because they might be able to take it forward and you're not able to take it forward. Or they might be able to come back to you and say, okay, we're going to do this. We want you to be involved in it. So, collaborate, collaborate, collaborate. It's something very important that I hope you kind of, take on board as you move through your own kind of careers. I've shared some very, stern pictures of Winston Churchill. I don't know if there's any picture where he was actually smiling. I've certainly never seen any. But the fifth tip is don't be afraid to fail. And I'm sharing 2 quotes from Winston Churchill. Success is not final. Failure is not fatal. It is the courage to continue that counts. And success is stumbling from failure to failure with no loss of enthusiasm. So some of you might look at my career journey, you might be like, oh wow, she's Superwoman, she's done so amazing. I've failed so many times, I've just got accustomed to failing. It's disappointing. I usually allow myself to have a pity party for a day or 2. Might involve buying a new pair of shoes, can't afford the handbags now since I had the feral human. But, I give myself time to be like, oh, this is so hard, and then I pick myself up, I dust myself off, and I move forward and think, what am I going to do next? What am I going to learn from this? How am I going to do it differently? My advanced fellowship is something I got the second time around, and I'm so glad I didn't get it the first time, because the first time I had planned to do it 100% for 3 years. And actually, I didn't want to do full-time academia 100% for 3 years. So the second time I went for it, I slightly changed it around and I did it 60% over 5 years, which then allowed me to do other things. And it has been a much richer experience as a result of doing that. So don't be afraid to fail. The 6th tip is something in general. Find a great mentor and pay it back. So it's important to have a good mentor. And I was lucky because when I got the starter grant for clinical lecturers, the Academy of Medical Sciences had a formal mentoring scheme. I think the NIHR also has a formal mentoring scheme. Use that. Allow yourselves to get a mentor, because a mentor is really important. This is someone who sees more talent and ability within you than you sometimes see in yourself, and they help bring it out of you. And it's not someone who's necessarily walking ahead and telling you what you should do based on what they did, but it's somebody who's walking alongside you to show you what you can do. And I'm very grateful to the mentor I had. So it was Professor John Strang, and he is still a professor of addiction in London. And I remember when I was working with him, I was really at the point in my career. So I was in my academic clinical lectureship and getting to the point where I had to make a decision about what I wanted to do next. And I was under a lot of pressure because the academics wanted me to commit 100% to an academic career, because that's what public health academics did. They didn't try to kind of mix it with local authority work or anything else. And then the people in local authority were saying, you're going to have to make up your mind whether you want to be us or you want to be them. And I wanted to be with everyone. I like hanging out with different people, so I wanted to do them all. And what John Strang did is that he gave me the confidence. He said, well, why not go for it, Kyla? What's the worst that could happen? He's like, the worst can happen if it doesn't work out. You find something else to do because you have such transferable skills. And I went for it, and it was really nice because at a conference, the Society of Study of Addiction conference last year, he was there. And I was able to go and give him an update about my professional life, my personal life, and tell him, oh, look, I've just been promoted to associate professor. And he just gave this really nice, kind little smile that he does. And he's like, it all worked out, didn't it, Kyla? I was like, yes, it did. So isn't that lovely? But when you've benefited from a mentor, remember to pay it back, because at every stage in your career, there's somebody coming up behind you who can benefit from your experiences, who you can give that kind of support as well. So don't just take, remember to give back as well. Remember to pay it back. The last bit, because I'm getting a bit tired of talking, although I do like to talk, is to be authentic. So you can always be a first-rate version of yourself instead of a second-rate version of somebody else. And when I started in Oxford all those years ago, I had a professor, a very important professor, tell me that I couldn't be serious about academia if I had time to wear lipstick. Honestly, I am not making this up. As you can see, I am still wearing my lipstick. For those who are interested, it is Revlon Black Cherry. It suits all complexions, let me tell you this. But just imagine that as a young coming up to a different country and being faced with that level, that I couldn't be really serious about it because I was wearing lipstick. Now, if you know anything about Trinidadians and our culture, my husband says we're vain people. We're not vain. We like to look good. We care about our appearance. It's just something that we do. I mean, we get holidays if we win Miss Universe or Miss World and that kind of stuff. We have a holiday for everything in Trinidad. But the whole point is, be yourself. You cannot go through life trying to be someone else. If you're interested in doing qualitative research and that's your passion, do qualitative research. Don't do quantitative research just because someone says that's where you're going to get all the high impact papers. If you want to have a big research group and develop that, go ahead and do it. But if you don't want to, and you prefer working with a smaller group of individuals, a smaller group of research associates, then do that. Be authentic. People can smell a fraud and a phony from a mile away. If you're wanting people to trust you, you're wanting people to collaborate, you even want to be happy, be authentic and be yourself. So, to summarize, my tips: do what you love and love what you do. Embrace opportunities. Dare to be different. Collaborate, collaborate, collaborate. So important, I've said it 3 times. Don't be afraid to fail. Find a great mentor and pay it back. And lastly, be authentic. I will end with this quote by Eleanor Roosevelt. The future belongs to those who believe in the beauty of their dreams. The future belongs to you. Continue to dream. Continue to believe in yourself. That's it.
Wow. So you lived up to the billing of the inspirational speaker. So Kyla, love the pity party. And as a podiatrist, I can strongly suggest that shoes come before the handbag. Love the pay it back too. I think, you know, this is a big part of, I think, what the Academy ethos is, the NIHR ethos is. It's around developing you and developing others. Can I just ask, so I'll take questions from the audience and online. Has anyone got any questions? Oh, so yes. So Douglas. We've got roving mics. And on the online delegates, please type in your questions. We're getting them through, so that's great.
Thanks very much, Kyla. I'm a public contributor, and I was really interested to hear what you had to say about public health. It's recently, or a few years ago, placed in local authority, and the funding competes with lots of different things. So I'm just wondering whether you think, firstly, that's the right place for it, because I know that there are lots of determinants of health and welfare, and some of them lie there. But alongside that, you also said that local authorities aren't used to looking at evidence. So how do you go about persuading them that evidence is what they should be looking at, bearing in mind that we've got population health management coming down the line?
Very, very good questions. And is this being filmed? So I don't know if I can say, because I've identified what local authority.
Yes, it is being
filmed. It is being filmed. Okay, so I might have to come and give you like some part of my answer outside of this meeting in terms of where it is. So I think the important thing about public health in local authorities is it does allow us to work with other colleagues like place and other things and, you know, the wider determinants of health. I think one of the issues is that we have gone into local authorities at a time when they are strapped for funding, and we haven't had that level of investment in public health going as well. So it's made for very difficult circumstances to try to practice public health. And the other bit of the part that I want to say with that, I have to say that outside, because I have very strong opinions on that. The population health management, that's very exciting. And, you know, sometimes in public health, we say the NHS is kind of recreating what we've already been, you know, talking about in public health. But it is really important as a way of identifying who are the people that you might need to intervene and you might need to put more support in. But it shouldn't be done at the kind of loss of understanding that on a wider population level, things that you do, so instead of just intervening with people who are at the highest risk, you do need to intervene across the board to have the greatest benefit as well. So you need to be able to have a mixture of those different types of interventions. So that's what I would say. And find me in the break, and I shall say what the other things I have to say. Thank you for that question.
Brilliant. We'll get the roving mic over. We've got 2 questions here, but I'll go to an online question. Oh, you don't have a roving mic.
Okay, so from the online chat, we've got lots of very positive comments about your talk, so thank you very much, Kyla.
Can I have them collated so I can use for my professional appraisal? That would be
absolutely.
great, thank you.
A brilliant talk, thank you very much. It was refreshing to hear about a successful career trajectory that incorporates balance and your passion. But the question is, would you recommend doing a clinical lectureship before applying for a postdoc fellowship? Do you think it's a must?
It probably isn't a must. It depends on what that person's background is and what they're wanting to do. So you don't have to do it. I think you can go straight into it if it works for you, but it depends on the person's personal circumstance. So it's not a one-size-fits-all.
Brilliant. Thank you. I think that's one of the problems we have, a question over there, one of the problems with when you see a pathway that you think you have to go along this linear path. I can tell you the most interesting careers are the ups and downs and the non-linear pathways. Oh, so yes?
Thank you. It was a really super talk. I think what you said about taking opportunities as, taking them and seizing them as you see them. How do you make sure you can do that strategically rather than kind of going, shiny squirrel syndrome, so that you don't end up, spreading yourself too thin and burning yourself out?
And that's a really, really good question, because I think you have to think strategically about where you're trying to go and where you're trying to be. So think about where you want to be in 3, 5, 10 years and which opportunities align the most with where you see yourself and who you see yourself as. And I think that helps, because it is a lot. If you're trying to really manage and do all these grants and do them properly, you don't want to have like lots and lots of little bits in terms of what you're doing. So I think you have to choose the things that really align with the direction that you're wanting to go in, would be my advice.
Thank you.
Brilliant. Thank you.
Oh, hi. Hi, Kyla. Impressive resume. And well done.
Thank you.
So my question is, I've been given an NIHR systematic review fellowship in the past, and one thing I realized while I was doing that was the sort of lack of representation, people who look like me and things like that. And it made it a bit difficult to be able to chart a career path for myself. So everything that I've had to do up to this point was sort of novel, and I'm just sort of making it up along the way. So I just wanted to know if you had a similar experience, and if that did or did not impact your trajectory or your career path, or how that influenced how you were able to do things, and if you came up with things like imposter syndrome and how you were able to overcome that. Thank you.
So really, really good question. And, I wanted to, so as part of this presentation, and you notice I still have my Trinidadian accent. I've never changed. I've never tried to fit in. Although sometimes I did feel that there was this pressure to try to be someone different. I remember just coming to this realization. It's like, you know what? People are going to notice me because often I'm the only face in the room that looks like me. So let's give them something to talk about. And that was my attitude. I do understand that I came from Trinidad, so I spent the first 24 years of my life. So I had quite a solid identity. It might have been different if I had grown up here and had to face some of the challenges that people of kind of minority groups face here. So I remember when I came over, I didn't even know what BME meant. I was like, what is that? Because I'd never heard the term before. And it's really interesting because I was like, oh, because I told my husband, I was like, when you go to Trinidad, nobody puts you in a category of white and minority ethnic. People, he's like, oh, people look at me. I was like, people look at you because you look as though you've never seen the sun before, compared to kind of, other people of European descent to Trinidad. That's why people look at you. But he had a sense from that visit to Trinidad about what it is like to be different from others and to stand out. And I have to say, you do have imposter syndrome. Everybody has some kind of experience of imposter syndrome. And as I said, so I touched on some things about, being told I didn't have enough gravitas. That was linked, I think, to the fact that I didn't look like the other clinical directors. So there was somebody telling me, oh no, don't do that because, you're not made for that. And it annoyed me, actually. It annoyed me a lot. I do think that it is something, I do worry about some of the conversations that you're hearing kind of nationally and things that are happening. Because it is important, diversity, inclusion, equality, all of those things are important. And often when I go to meetings, and I'm often the only person in the room that does look like me. And, sometimes it's just like, oh, yeah. But I've learned to deal with, it. I try to be encouraging and supportive of everyone. But people, when they come to me for advice, I try to kind of, say, well, these might be some of the pitfalls you might have to face. But it is really important to be true to yourself and not to try to change yourself to fit in with anybody else. So that's where the be authentic part of it comes in as well. We are all incredibly special and incredibly unique human beings. And even though you might face that pressure, and the pressure is harder the earlier you are in your career, but carry on being who you are and look for support. I've had different mentors, different people who stood up for me at different parts of my life. But I've also, and I'll be honest, faced some really incredible bullying that has been quite hard to deal with based on who I was as well. So, I'm a survivor.
Can I just also say at the NIHR we know that we don't have appropriate representation, and there are a whole lot of initiatives that we need to do to make sure that there are people who look like you in the room. We absolutely know that, and we take that seriously. Last question online. So Vicky.
Oh, microphone's on. Yeah, so thank you, Georgia. She'd like to say, what are the do's and don'ts when approaching a potential mentor?
I think be brave and ask, because the worst that could happen is that they say no, and then you'll have to find someone else. And don't take it personally. If they say no, often people are quite busy. There might be loads of other people who've asked them to mentor. So don't hold it against them if they are able to say no. So, I just think, be brave and just ask. And if the person says no, then, don't be too disappointed and look for someone else would be my tip.
Brilliant. And can I just say, the NIHR mentoring scheme at the moment is only open for postdocs. That's going to change, but we've got to put the case to the Department of Health and Social Care. But it does have resources for exactly this: how to approach people, how to develop that are for everyone, so not just people part of the academy mentorship program. So, okay, another quick question, and then we'll have to move on.
Very quick one. So I'm someone who is, say, just an academic, and I constantly feel like I'm juggling far too many balls. So have you got any tips for people in the room about you must juggle so many different priorities with your different hats?
I think, because people talk about work-life balance, and there was a really interesting article that I read about, it's saying, stop talking about work-life balance and start talking about how you manage your energy. Because there are things at work that are energizing, there are things at work that are draining, but there are things in your personal life, so if you have children, that are energizing, and there are lots of things that are incredibly draining about it, and I might quite prefer to be doing my research instead of doing that particular thing. So, again, so as a 100% academic, and my husband is that, there's a lot of teaching, and, and there's lots and lots to do, and you just have to, sometimes you have to learn to say no, and that's quite hard, and sometimes it's harder for certain people to say no than it is for others, because I've seen my husband just say, no, I'm not doing that. I was like, oh, I say no with lots of different reasons why I can't do it and things like that. And I think sometimes as women and stuff, we probably are looking for excuses, or you're feeling a bit bad about saying no. You have to learn to say no, and say no and be kind of, really firm about saying no, or saying, well, if I'm doing this, I'm going to have to give up this to be able to do it, because you can't burn yourself out. And I would say last year is probably a time I almost came close to burnout, because I pushed myself right back from maternity leave, and I felt I had to prove to myself that I could still do it all. And I pushed and pushed and pushed. I wasn't successful in that particular grant I went to, but I kind of felt, Kyla, you've gone too far this time. You shouldn't have done that. And I kind of learned and reflected from it. So I've had a year off from applying for any other grants, and I also took a step back from teaching this year to focus on everything else. And I feel very rejuvenated and things again to then go for it next year, or to have my plans. But you have to balance things. You have to learn to say no assertively.
Brilliant. So Kyla, thank you so much. Absolutely superb. The online delegates will get to ask more questions to Kyla, so thank you.